So David, you're the head of the Game Show Network. How did somebody in your position decide, I want to go tackle America's healthcare system and expose it?
Well, I don't think I did decide that. My interest in healthcare came out of what happened with my father. My father entered a hospital, little shortness of breath. They kept him overnight, and a series of really accidents led to his acquiring an infection, and he never left that hospital. He died 5 weeks later. And if you've ever been through that process, it's extraordinary in many ways. Hospitals are very different than almost any other high-functioning institution in our society, and it feels strange in a lot of ways, but I probably would have left it there, except about a month after my dad died, Atul Gawande published an article in the New Yorker about hospital-acquired infections, which is what my father had died of, and how most of them were now preventable.
And how common this is.
And how common it is. That's an excellent point. So the estimate now is about 100,000 people die of hospital-acquired infections, many of which are regarded as preventable. And there's a whole series of other accidents and errors you learned about that also cause death and injury. But that's the one I focused on. And Atul's article struck me because they're preventable. And they're relatively low-cost preventable. In fact, there was a series of protocols designed that where used cut the death rate 2/3 by 3/4. And I guess the combination of the grieving son and businessman in me said, wait a minute, what type of system causes you to underinvest in such low-cost safety?
And keep in mind, if I recall this story correctly, your father gets the infection at the hospital, he dies, and then they send you a bill.
Well,
they
did
send the
send us
family
a bill,
right?
Yes, and it's interesting because they sent us, first of all, they sent us a bill a year later, which is remarkable, and a tiny bill. A bill that showed total charges of almost $700,000, and our share being $900. And that struck me as interesting as well, right? Because bills serve a purpose in our economy, and it's often a communications purpose, and that one is, you got a great deal. My mother would argue $900 for paying the love of her, for killing the love of her life was too much anyway. But it was interesting that you had this sort of monopoly money of charges on the bill, $600,000, $700,000, conflates to nothing, right? He could have stayed at the Four Seasons and we could have brought in all the doctors and all the nurses and all the medical equipment for far less than he would have gotten free TV, right? So it has no reality and isn't intended. No one's intended to pay $700,000. We in fact didn't pay the $900. But the whole thing conceptually made me wonder. And made me wonder about the fundamental incentives in healthcare and how they could be so distorted that hospitals didn't invest the relatively low cost to save patients' lives. And I think a lot of us as citizens assume that regulation will take care of that. I was more interested not in the failure of regulation, because it is a failure of regulation, but in the lack of dynamic incentives for good behavior.
Well, and you wrote a book out of all this. Your determination was to figure this thing out, and you wrote a book called Catastrophic Care. How would you sum up, as short as you can, your prescription for fixing America's healthcare system?
Well, for me, almost all of the problems in our healthcare system, and by the way, it's not just our healthcare system. No matter what people talk about other healthcare systems around the world, they all have major problems in the 21st century, come from the poor choice of customer. Now, healthcare is an industry. Even as a nonprofit, it's an industry. It's people earning a living. And the incentives we've given them are serving an insurance customer or serving a government customer. And it's something so complicated, so ever-changing, so personal, that's the wrong customer. And if I look at what happened to my father, and then I trace it through some of the other dysfunctions we all see, cost and value and transparency and use of technology and innovation and just pure quality and safety, what you see is how distorted incentives lead the healthcare industry to do what it takes to satisfy its government insurance customers, but not what it takes to satisfy us, the patients, who in other industries are called consumers.
David Goldhill, thank you very much.
Thanks for the time today.